Welcome to Religion, where we highlight and teach you our best health practices for mind and body. Here are your hosts, Brent Anderson and Veronica Sosa.
Hello, my name is Dr. Brent Anderson, and I'm with Veronica Sosa, and we're here on behalf of a religion episode, and we're excited to be here today, and we're going to be talking about the pelvic floor and breathing. Veronica, tell us a little bit about what you're thinking of today.
So the reason that we decided to do this episode is because, not just from personal experience after having had a baby, but it just seems like there's so many women who struggle with issues regarding their pelvic floor, and many of us are doing yoga and Pilates and just trying to connect our mind and bodies. And as a psychotherapist, that's one of the things I'm constantly working with my patients on, is just really trying to get them to the best version of themselves and trying to get them to a state of optimum functioning.
This is the exciting part of what we collaborate on, Veronica, is because of your psychotherapy background and my physical therapy background. We both have, left some of our traditional fields and been looking across the river and saying it's not just physical and it's not just psychological, and that we understand that, we are such complex creatures sometimes. And when we're dealing with something as sort of sacred as the pelvic floor or forbidden as the pelvic floor, I think it's fantastic that we can talk openly about it, and we can talk about the social, the psychological, and the physical elements to it, and hopefully give you some really good tools that you can use, at home, even starting today. As soon as you hear this podcast, that you'll be able to apply some of the things that Veronica and I will be sharing with you.
So let's talk a little bit about what viewers can take away today. So we want to make sure that you leave today's session, let's call it that, with some takeaways, some tips. We're going to talk specifically on diaphragmatic breathing and the importance of breathing in strengthening the pelvic floor. We're also going to talk about some proprioceptive exercises. We're going to talk a lot about that mind-body awareness, and which oftentimes leads to a psychological awareness of what's coming up for people emotionally. And then we're also going to talk about how there are certain devices and proprioceptive devices out there that can also help bring awareness and really work on those proprioceptive skills. So just to start off, I mentioned a little while ago that I had some personal experience with this. And I think most women, at some point when you go to a gynecologist or you have a baby or you get to a certain age, even if you hadn't had a child, just the aging process alone, at some point we've heard a women's health expert tell us that it's time to start doing Kegels. And I thought for years I was doing it. I was very responsible. I was doing it, and I thought I was doing it correctly. And it wasn't until after I had my son that I realized that I was starting to have some issues, and that I ended up having to go to an occupational therapist. And when she did some very intrusive testing, she told me that I was not doing my Kegel exercises right. I mean, I was doing them very, very wrong. So all of these years that I thought I was doing something good for myself, I was actually not training myself well.
And you're so not alone. I mean, this is one of the most common things we hear about in physical therapy, or that we see. And I think part of it is you sort of use the words intrusive testing. As a physical therapist, if I was checking your neck or your shoulder or your foot, you might say it might be a little uncomfortable, but you wouldn't say it was intrusive.
Oh, no, this was totally intrusive.
Well, it's because it's the pelvic floor. You're having a vaginal or anal exam, and the first thing we think of is like, oh my gosh, I don't want to have to do that. I don't have to deal with these type of problems. And the first thing we want to remove away in a take-home message is that, look, almost everybody deals with these kind of things, men and women. Usually when men deal with these issues, they squeak a lot louder because it seems like it's so wrong. And a lot of women are just told by their mothers and their aunts and their sisters, it's just part of being a woman. And the message we want to share home today is, no, that's not true. A lot of people have it, but if you deal with it, you can make it so much better. And I think the first thing, outside of just disclosing that and saying, thank you, Veronica, for sharing that, you've had this history in the past, because so many people have. The biggest tip I think we can share with you today is just a little bit of knowledge. even the right vernacular to talk about the pelvic floor. And most women and men are told when they have these issues by their doctors to do what you said, Kegels. Kegel's the name of a doctor that was a gynecologist that basically was teaching women how to restore the integrity of the muscles of the pelvic floor. You also said something else very interesting. You said that once you went through the intrusive testing, that you realized that you had been doing it, I hate to use the word wrong, but
No.
maybe not as correctly as it could have been.
No, it was really, really wrong.
Well, you're doing your best you could. And the point is that we did a study and we looked at 250 Pilates teachers who were teaching pelvic floor exercises, and 45% of them were just like you, Veronica. They were doing it incorrectly. And they thought they were lifting their pelvic floor up and they were pushing their pelvic floor down or doing other things. And I think this comes back. You used a really important word, and I know that sometimes we use big words, and we certainly don't have any intention of doing them. Matter of fact, Veronica and I said, let's make sure that we explain some of these big words that you hear at the doctor's office so that you really understand. We can take away the fear, right? Let's remove the fear. But the word was proprioception. And what proprioception means basically is awareness. So when we look at somebody with their limb or their hand, if I said, took somebody and closed their eyes, I said, is your thumb up or down? 100% of the time, they're going to be right. But it was interesting. We did that study with experienced Pilates teachers, and we said, is your pelvic floor lifting up or down? 45% of them did not match what they thought they were doing. And that led us to a suspicion to think that, if people that are teaching it are confused and don't have awareness, you can imagine the number of people out in the world that are dealing with pelvic floor issues that are confused and having problems with that. And that leads just to a little definition of, what is a pelvic floor issue? What are pelvic floor problems when people talk about it? One of the most common ones is a stress incontinence. And that's very, very normal, actually, very common, that you get out of a chair too fast, or when you're jumping or a trampoline or running, that you might experience some leakage from the stress or the compression from gravity.
And also when women cough, that they say that
coughing, laughing,
right?
Yeah. And anything that increases the intra-abdominal pressure puts pressure on the bladder, and then if the pelvic floor can't respond in time, it will leak. It doesn't mean that the pelvic floor is not strong. It actually means that the pelvic floor does not respond in time, that urethral sphincter does not respond in time for the pressure. So it's like the laugh, and the pressure pushes down, that sphincter just is a little too slow, and you have a little leakage if the bladder's full.
And isn't it right? Isn't it correct that sometimes women can have incontinence from actually too hyper?
I don't remember the exact statistics on it, but it's actually a very large percentage of women have incontinence due to hyperactivity of the pelvic floor. And maybe a good way of thinking, the pelvic floor is like a diamond. So it attaches to the front bone of the pubis and the tailbone in the back where my thumbs are, and then it comes out to the sit bones, and it makes this sort of triangle. And you could think of it almost like a hammock, is how I like to think of it. And it's relatively elastic in nature. So a lot of times, in sort of contrary to what we were taught with doing active Kegel contractions of lifting the pelvic floor up, it actually responds, we think, a lot more like an elastic trampoline or a hammock. And so when the pressure increases, the hammock descends and it stretches a little bit. And then when the pressure decreases in the intra-abdominal area, it springs back up. So what kind of things would cause intra-abdominal pressure? Well, lifting heavy things. And if you think about it, your preparation to lift a heavy box, you're probably not going to leak. But if you jump or cough or laugh, you're more likely to experience a leak. It's not that you're not strong. It's that the timing of it isn't right. So you get the load too fast and you're not ready for it, and all of a sudden you realize, oops, I leaked.
Is that the same thing? Is that related also to how weightlifters or professional or the people who do the bodybuilding, right? Don't they have to learn to time their breath with how they lift weight?
Absolutely. And it all goes back to this idea of intra-abdominal pressure. So a weightlifter will wear a big belt around their waist, right? A big leather belt. and they strap their knees up. And when they get down, they take in a deep breath, and then they let out a loud noise, right? Ha! As they bring the weights up and to go up into their clean and jerk or whatever activity they're going to do. And what they're doing is they're using their throats to control the air coming out of the lungs to keep the pressure from the lungs down. And then the pelvic floor putting pressure from the bottom up, and then the belt around their waist they're pushing into. And all of those things, we call it a hydraulic amplifier. You know, like when you lift up a car with a hydraulic jack, you're doing the same thing. It creates a massive amount of power and stiffness around the core. And that's the core control that people talk about. What I think we get confused on is we think that core control and incontinence are directly related. And I would say that they're not always directly related, because a lot of times it's not how strong is your core, and it's not how strong is your pelvic floor. It's more of a motor control issue. It's like
how well do they work together?
Yes. It's more like that's, do you have the ability to have spontaneous reaction to that? So for example, if I push somebody, they're standing up and I push them, they're going to have a natural riding reflex, and they're going to step out and change their body weight to prevent falling, right? If I push them too hard, more than what they expected, they'll fall down. And I think that's sometimes a nice way of thinking. If you're preparing to lift a baby up or preparing to lift a box up, you're probably not going to have a leaking moment there, even though the intra-abdominal pressure went up. But a cough or a jump or something fast might be just fast and it's out of sync, and that pelvic floor doesn't react in time and you leak.
Is that why a lot of women can't jump on trampolines after they've had babies?
Yeah. And I've been, it's funny we talk about
the timing of the land probably is also a different rhythm for the body. So it's harder to predict the contraction or how that sphincter is supposed to.
So let's think about this like any other muscle in the body. If you wanted to be able to prepare your body to react to spontaneous load, you would be doing the activity to create the load to train the muscle. The problem with the pelvic floor is the consequence is you pee on yourself.
And that is so, let me tell you, I think this is where the psychology of all of this ties in, because that can be extremely traumatic. For like the first time it happens to women, I think, like, I'm not trying to be dramatic here, but I think it's almost like your world comes crashing down in a way, because you're like, oh my gosh, because there's these ideas tied to stress incontinence that it's like, this is what happens to older women, or this is what my grandmother used to talk about, or my mom used to talk about. I never thought this would happen to me. And, the other thing is that, and going back to the age factor, I think that is also really a key thing to discuss, that some women who have stress incontinence have never had children, but the aging process and the hormonal changes that happen during menopause can actually cause laxity in a lot of our muscles, which is one of the reasons we,
And it could also be sedentarism. We could just be sitting too much.
You're right.
That also has an effect on the pelvic floor.
But I mean, there are biological reasons that as we age, right, that tend to be associated with this, like these hormones.
There are, but there's some studies. If you look at, women, for example, that live in countries where their toilets are squatty toilets, squat over a hole, or their culture is in a full squat. And I'm going to show a picture here of a full squat, because I think this is important. And we'll come back and talk about some squatting exercises. But notice in this picture how the ankle dorsiflexion is really deep and they come all the way down. And what happens to the pelvic floor is that the pelvic floor now is a little distended in that full squat position. And so women who practice that up and down in the squat have less incidence of those types of problems, because they're always training the pelvic floor by going down to squat and coming up. Those of us that live more sedentary lifestyle, we sit in a chair. When you sit in a chair, you completely relax your pelvic floor theoretically, right? You relax your body sitting in a chair. You don't have that elastic load like you would in the squat. So I'll get rid of the picture. And I think this is important for us to understand, is that our bodies respond to the load that's placed on them. And you brought up a really good point, Veronica, in the idea that when you have that dramatic moment, and it is dramatic, and I remember going through this, with family members of mine, and my answer to them was, train it like you would train any other muscle. Put a little protection in your underwear and go out there and practice jumping on a trampoline, or coughing, or laughing, or running, because it's going to be the tempo and the load that are going to spontaneously train that response. But the negative effect of it is so horrifying to people that they just say, I don't jump on trampolines.
Exactly.
Definitely not in public.
Yes, and this ties back to one of the sessions that we had before, one of our previous sessions, when we talked about pain response and the psychology of pain responses, and how once somebody believes that they have a knee injury or some kind of pain when they do a certain movement, they don't want to do that anymore. And there is something to be said for taking it, recognizing it, obviously being aware of it, and then trying to expose yourself to either a modified version of the same stimulus or whatever it is, so that you don't start losing ground on certain things that you enjoy doing.
And this is where we talked about this in the pain thing, was creating a positive movement experience without pain. Could you create a positive movement experience without leakage?
Exactly.
That's our goal. So do we start with a slower elastic response on a trampoline that's a slower thing where the anticipation's right, and then we change the tempo? And then do we do it to where we're jumping rope? Something that has, and we change the tempo and jumping rope, and you train the pelvic floor, and then gradually even things like, hey, what about trying to do that exercise with a full bladder? Like, you got to pee, and go jump on the trampoline or jump rope and see if you can condition your pelvic floor to respond. And, as negative as it is in our minds to think of losing continence, this is part of the training, is like, we can't be afraid of that if we want to overcome it.
Right.
And so you just need to use some protection and, know that you're doing all the right things. And still, it might not be perfect. If you get caught off guard with a cough or a sneeze, it still might get you. It just might get you. And I think that there's enough good products out there to make it so that it has minimal embarrassing, component to it in public. But I do think that we can train for it. And
so let's, sorry to interrupt you, Brent. I want to, just to kind of wrap it up, because a lot of, we're coming up on our time here. Let's talk a little bit about some of those tips and things that people can take away from today's session. So we're going to do a whole separate seminar or little episode on breathing and different breathing styles. But let's talk a little bit about diaphragmatic breathing to help with the floor, and what we can do to identify our breathing style and what we can do to modify it.
So those of you that are with us and watching right now, one of the things that we want you to do is just sit up in your chair. And one of the things we noticed as we were looking at these women that were dealing with poor awareness of their pelvic floor is that breath had a 95% correlation with accurate proprioception. So when they inhaled, they had a normal descension of the pelvic floor. When they exhaled, the pelvic floor came up. And we noticed that the women who were having troubles with that also had some incontinence issues, were not using their diaphragm. And so this is where we were thinking in the Pilates world, where I sort of live in teaching movement, we thought that the Pilates exercises were strengthening the pelvic floor, that were minimizing the stress incontinence. And what we think now is maybe it's more the breathing exercises that are so prevalent in Pilates that were actually affecting and improving the stress incontinence. So let's give it a little try.
And the interesting thing, tying it back to the psychology of it all, is that stress, the teaching strategies that we use to release stress also has to do with the same breath style that you're going to need to help build your pelvic floor. So these things are, it's not just
intertwined. You can't
intertwined.
Okay. Yeah.
All
So
right.
One of the things we want to look at is what kind of a breather are you, right? So let's start with the hands on the side, and just notice when you take in a deep breath, do your hands come apart? And when you exhale, do the hands come back together again? right? That would tell us that you have some lateral displacement, right? That ribs are moving out to the side, that your diaphragm's actually working, right? Another one would be to put a hand on your chest and another hand on your belly. And from here, just taking a deep breath and notice what moves first. Do you breathe into the upper chest first, or do you breathe into the belly first? Right? And none of them are wrong. They're just different ways of breathing. But there's one particular one that we're concerned about. And this is somebody who breathes with their neck. So I want you to imagine that you were a smoker, right? We say it's a smoker's breath. And if you put your lips, your fingers up to your lips, and you feel, and watch my neck, you'll see my neck contract to bring in that air, and we call that accessory breathing. So accessory breathers often have poor pelvic floor awareness.
And accessory breathers also tend to bring up their shoulders, right?
Absolutely. Absolutely.
So
There's nothing happening down here, right? And in order for us to get the pelvic floor to respond, we have to have something happening here. So either you're going to feel the rib cage expanding, or we can also feel the belly expanding. Both of those are successful ways of facilitating pelvic floor. Now, I'm going to throw that picture back up of that squat. And the home exercise is if you can get into this squat position and then practice that deep breathing and imagine that as you're inhaling, that you're actually blowing up a balloon that goes all the way down into the pelvic floor. So you can also feel the expansion of that pelvic floor. And when you exhale, you can feel the pelvic floor naturally spring back up. So again, assuming the position of the person in squatting position here, just take in 2 or 3 deep breaths. And I would do this 2 or 3 times a day if you were dealing with some pelvic floor tension. This is a nice way to relax that pelvic floor tension that often is the cause of incontinence, and even more so, vaginal irritability and pelvic floor pain often come from hyperactivity and spasticity, not from flaccidity.
And even with, believe it or not, even with constipation, I have many clients who have constipation issues as part of their whole stress response, right? And that the breathing exercises of really kind of training your body to have that diaphragmatic breathing almost helps to mobilize the intestines as well, right? And just get that natural rhythm that your body is supposed to have.
All of those things. So I mean, you think of breath. There's not a void of material here. When those lungs come down, that diaphragm comes down, it's pushing on your stomach, on your colon, on all of the organs in your body. There's no empty space, and that's why when you take a deep breath, it's just mechanical. It's pushing the guts down, and the guts are going to push the pelvic floor down. And then when you exhale, the diaphragm relaxes back up into its dome, and the viscera comes up, and the pelvic floor springs back up. The only thing that really changes is when we add load to that. And so that's where we see often problems, is that cough or that sneeze that you're not prepared for. Is there's such a sudden jerk of pressure going down on the viscera that the bladder gets pushed and the pelvic floor is not ready to respond. And I would bet you that, children going through development do this as well, but they wear diapers. So as they develop and they start realizing that, you don't want to have these accidents. But I bet if we really looked at how often do accidents like this happen in children, say even in between the ages of 4 and 10, I bet you we'd find children that were having little accidents here and then with things like sneezing, coughing, or sudden movement. I don't think it's just an adult issue. I just don't, kids don't make such a big deal about it.
Right.
They just came out of diapers. What the heck?
And we see them as, if they do have an accident, that it's, it's okay, right? Like there's not this negative stigma attached to it all the time. So.
Well, we hope not. And if they do it at school, we hope no bullying going on.
Of course. So let's talk. So we talked a little bit about the squatting for proprioception. Do you want to? Is there another exercise with the squatting that you want to talk to us about?
Well, this one's a little more private, and but it is basically feeling the pelvic floor. You can do this externally over your clothes, but it is literally placing your hand on the pelvic floor and observing how breath facilitates the pelvic floor dropping down and rising. And I think when, again, in the beginning, if we can just get good proprioception, good awareness, and understand our body parts and go, oh, that's the pelvic floor.
Right.
Oh, that's the urethra. That's where I pee out of. That's the vaginal wall. That's where we have intercourse, and that's where your period comes out. And it's amazing to me as a doctor of movement that even in adolescent and young adults in their 20s and 30s that haven't had a child yet, that they're still confused as to what orifice they pee out of and what orifice they would have intercourse with and what orifice they would poop out of. They still have confusion. So, you know, whatever we're doing in our sex and body education in 4th grade, we still have people that don't really understand it. And I think sometimes it's because we have this sort of stigma of like, you know, you turn off as soon as somebody talks about your private areas. But this is a good time, like when you're taking a bath or a shower or you're by yourself, is just to learn your body, just like you would learn. You look at your face, you look at your eyes, you look at your mouth and your teeth, you look at your hands, and we look at it, see what our skin's doing. It's the same thing. Become familiar with your pelvic floor, just like you would with any other part of your body. And, you know, and then look at how it responds to breath, how it responds to different activities and different loads. Like you can even feel when you lift up something heavy or weights in the gym, you might feel pressure there and go, oh, I never recognized that was the pressure on my pelvic floor. And just having that knowledge can make all the difference in the world of knowing how you're dealing with it.
Yeah. So what are some of the other tools that we can use for increasing awareness, you know, beyond the exercises that you just gave us, which are really valuable? There are devices out there. I personally found, I mean, I did all of the things that you have just talked about. I have the benefit of my husband is also a physical therapist. So I just, you know, he's a fountain of information for me constantly, right? But the thing that I found the most benefit with was actually using tools to help retrain the correct muscles, like these devices that are out there, and they're not all the same. Different things are for, you know, there's different devices for different things, I guess, but the ones that were specifically the most helpful for me were the ones that helped to, you know, I wasn't being like hypertonic in my hyperactive in that tension, but it just helped to bring awareness to that part of my body in a relaxed state, which I thought was really helpful and beneficial. And it was something that I was, you know, using.
Well, I think there's some really powerful tools out there. And I mean, in women's health and pelvic floor health, I mean, we use things that have, you know, biofeedback. So we have electrodes that can be inserted vaginally or rectally that would let you know if you're actually engaging a contraction, or even more importantly, how to relax. I mean, we typically use a biofeedback to relax. There's also weights.
Those aren't typically used at home, right?
Well, they can be used at home, but they're usually done under the doctor. So I'm just sort of giving you a spectrum of them.
Okay.
And then there's things that are conal or weights that can be used. And again, any of these things provide proprioception and awareness. And we've said that over and over again. The more awareness we have of how our pelvic floor works, what does it, you know, if I told you to make a muscle in your bicep and to make a maximum contraction and now make half of a contraction and now relax the muscle, you know, those would be ways that you would know and say, oh, you know, when you have too much contraction going on in that muscle. And that's what we want to teach in the pelvic floor. So you could, you know, use the cones or the proprioceptive weights. And, you know, the idea is how low can you let them drop in the vaginal canal without losing them, without them falling out. So what it's telling me is I'm relaxing enough that I'm not pushing it up into my abdomen, but I'm allowing it to come down and still have control over it. And you can even vary. I know there's some products out there that have different weights and different sizes and different shapes. And all of those things provide proprioception. And my belief is the better proprioception you have of any body part, the more awareness you have of that body part, the more equipped you are to manage these types of problems when they come along, because you understand. And so then it makes it very easy for somebody like me or my partners in women's health to be able to come in and educate and say, the pelvic floor, when you feel tension, yes, I felt that tension before, because you're aware of that body part. And after having a baby, for example, postpartum, there's no awareness of anything. So my patients come in, it's like, where's my abdominal wall? Where's my rib cage feels like it's flared out. My breasts have changed. My pelvic floor is different. And it's just reconnecting. So we bring back in, and typically, what do we use? We use breath to be able to start re-educating the connection between the rib cage and the pelvis. We use breath to be able to re-educate the pelvic floor. We start doing some subtle movements based on, as soon as they have clearance from their doctor, to start loading the tissues and using devices to be able to re-educate the pelvic floor and re-educate the abdominal wall and re-educate the back. I mean, we didn't talk much about the back, but it's like this cylinder. So we have to include the back muscles, the diaphragm, the abdominal muscles, and the pelvic floor all work synergistically together to be able to provide control.
We should probably do an episode specifically on postpartum issues.
I think that's
and then
great.
Another one on back issues, because I hear this so much. I work with women who have postpartum depression. And one of the things when we talk about, I'm very big on connecting mind and body from the very first session. And one of the things I ask them is, how does your body feel? And a lot of them break down and say, I don't even know who I am anymore. Like my body doesn't even feel like it belongs to me. It's gone through so much. My boobs are huge. My ribs. I remember when I had my son, the area that I noticed a real change was in my rib cage. When you said that your ribs flare out, I remember like a lot of my clothes was tight around my ribs, which I've always been really thin here. And so, this whole transformation that your body goes through, and then being able to reconnect it. And it's funny that you said reconnecting with the breath, because that's always where I start. I reteach them to find their center and to find their diaphragm and how to center themselves and calm and get in touch with themselves through diaphragmatic breathing, and just even feeling and trying to find it again. Like, because, you're by the time you're ready to deliver, you have had this belly, coming out of here. It doesn't even feel the same for a lot of women. So just trying to reconnect with the body and finding your center again, and finding where to start, and little by little reconnect with your body and feel it again in a very healthy way, I think.
And the closest I can come to understanding that, since I've never had a baby, is having a surgery on a joint. And they've gone in and they've cut up the joint and they've opened it up and they've changed things. And you come out of surgery and you're looking and going like, whose leg is attached to my hip? Like, all the proprioception awareness is gone. There's pain, there's other things. And as a physical therapist, our job is to reintroduce awareness and educate them. This is your leg, this is your back, this is your belly, this is your pelvic floor. And we're connecting it and getting that awareness to come back. And, no matter what ailment people have, always coming back to consciousness and awareness of movement is one of the most powerful tools that we can use. And I know sometimes in my profession, they just start looking, let's get range of motion, let's get strength. And it's like, wait a minute, slow down a little bit, let's get awareness. And then from the more spiritual and social and energetic side of it, I believe wholeheartedly when somebody has increased awareness of themselves, they see the world completely differently. And it's not just about your body, your pelvic floor anymore, but somehow having more awareness of your body makes you more conscious of what's going on around you.
Absolutely. Well, this was super helpful, Brent. I love these sessions with you because I feel like there's so much work that I do on the mental and emotional and social side of things. And then just seeing the tie-in that it has with the physical, physical and movement and
Inseparable.
All of it. It's just amazing. So thank you so much.
Thank you.
We will be back soon, expanding more on some breathing techniques and other things that you can do. So stay tuned, and we look forward to hearing from you. Thanks.
Look forward to it.